We're located at St. Joseph's Neighborhood Center, which is in the heart of the city of Rochester, New York. We are in our 23rd year, and what we do is provide primary health care and mental health services to those who in our larger community who are uninsured or don't have access to health care.
It's an interesting neighborhood, a little eclectic. It's much loved by the people that live here. Across the street is a soup kitchen, and there's transitional housing in the neighborhood.
Most of the individuals who come here probably haven't connected with the healthcare system very much over the last couple of years, so they could walk in with multiple problems. We're built in a way that we actually combine our mental health services with our physical health services, and our social work wraps around all of that, so it's a pretty unique service delivery model too. The introduction of the primary care practice through St. John Fisher Wegmans School of Nursing was the new element of serving the population that comes here, and it's proven to be a great relationship.
Hi, how you doing?
I'm good.
Good.
Yeah.
Well, I feel like they focus on what your needs are as opposed to what is your health insurance. I've gone places where I had to pay $200 just to get my blood pressure checked. I felt like a number. I said, you know what? I live in America. There's got to be another way. Here, I don't feel like a number.
You look very good. You look healthier.
Any practice discipline like nursing, the most powerful part of the education, I think, happens when you're engaged with patients and families. Leaving a place like St. John Fisher College, Wegmans School of Nursing, and having his or her first experience being in the community is kind of novel, but I think it's what we have to be concerned about in nursing education.
We're given the tools, we're given the knowledge, necessary to work to empower ourselves and to help empower other people. Fisher really, and Wegmans School of Nursing really especially cultivates those practices in its nursing students.
Somebody doesn't come here to be just a well-educated nurse. They come here to be a well-educated person. In this school, our students have the opportunity to have the full college experience, a wonderful education in liberal arts and sciences, a world-class education in nursing. But they're also athletes. They're also scholars. They're student leaders, taking part in the Teddy Dance, which is so close to the hearts of all of us here at Fisher in terms of who we are in this community and the kind of service that we provide.
It is the largest event on campus throughout the year. It's a 24-hour dance marathon for childhood cancer. We raised over $54,000. The kids actually come to the dance for a few hours and you get to interact with them. You get to make them smile and have them create great memories that they won't forget during their hard times.
In my undergraduate years, it was hard. I was on a competitive intercollegiate athletic team, and it took a lot of time and effort and energy. And nursing is hard, your studies are really hard and require a lot of time. So, they're always willing to meet with me after class, or to be flexible about missing classes here and there if I needed to do so for soccer. Fisher as a whole is just it's a friendly, personal place. It's a homey environment where people, have your best interest at heart.
The Fisher values, the tradition, the Basilian tradition around goodness, discipline, knowledge, as well as our Catholic heritage, which has always been concerned with the greater good. It's just a wonderful fit for nursing. And I think that's why, building on those values, we've been able to achieve the success that we have in terms of the numbers of people that we educate as well as the outcomes that we've been able to achieve.